In 2020, more than 17 million adults in the U.S. experienced mental health issues that were coupled with a substance abuse disorder. To help provide insight into the link between substance abuse and mental health, and help those in Montgomery County with co-occurring disorders find treatment, the Valley has created this guide. Understanding co-occurring disorders. A person who struggles with both a mental health condition as well as a substance abuse issue is considered to have what's called a co-occurring disorder, or dual diagnosis. Dealing with either a mental health problem such as depression, anxiety, or PTSD is often challenging enough by itself. But with substance abuse, and vice versa, the challenge is even greater. Co-occurring disorders come with their own set of symptoms that can greatly impair someone's ability to function at work or school, maintain a stable lifestyle, or handle unexpected difficulties. What's more, co-occurring disorders affect one another and exacerbate the severity of each disorder's symptoms. So, when drug or alcohol use increases, issues with mental health increase as well. Because the two issues play off of each other, it can be very difficult for an individual to break the cycle. And over time, the issues are likely to become worse if both are not treated. That's why it's crucial for someone with co-occurring disorders to be treated for both their mental health condition and their substance abuse issues at the same time. Do substance abuse issues develop before mental health problems? While substance abuse and mental health conditions are closely linked, one is not necessarily responsible for the development of the other. However, abusing drugs or alcohol can prolong and worsen symptoms of anxiety, depression, and other mental health problems. Those with co-occurring disorders are more likely to be using drugs or alcohol to self-medicate for an undiagnosed or untreated mental health condition. This is a key reason that mental health problems and substance abuse can be found together, and why the conditions exacerbate one another. Essentially, if you have a co-occurring disorder, it's likely that you use drugs or alcohol to try and mitigate depressive or anxious symptoms for temporary relief, but became reliant on a substance that is actually making you feel worse. And unfortunately, not only does drug and alcohol abuse perpetuate mental health problems, but it can lead to the development of new symptoms and conditions over time. Signs and symptoms of co-occurring disorders. Although you might think that a substance abuse problem is defined by the kind of substance you use, this is actually not the case. Instead, it has more to do with the effects your drug or alcohol use has on your life and relationships. The following are a few common signs or symptoms of substance abuse. Feeling like you should cut down on drinking or drug use. Repeated, failed attempts to stop use. Feelings of guilt or shame around use. Use has caused problems in your life at work or school or in your relationships. Common symptoms of depression. Feeling hopeless or helpless. Excessive fatigue or loss of energy. Loss of interest in daily activities. Difficulties concentrating, signs of an anxiety disorder. Constant stress. Feeling on edge most of the time. Trouble sleeping or insomnia. Restlessness. While these are common signs or symptoms of mental health conditions or a substance abuse problem, you should always speak with a mental health professional to help understand your symptoms. The Valley, a substance abuse treatment center in Montgomery County, specializing in helping those with co-occurring disorders. The Valley is a substance abuse treatment center that offers full, inpatient residential services for those seeking help with their substance abuse problems. Our counselors are highly trained in treating and supporting people with co-occurring disorders. Over the years, the misuse of and addiction to opioids such as heroin, pain relievers, and fentanyl has increased dramatically in the United States. The opioid and fentanyl epidemic is one of the most pressing public health issues in the United States today. Overdose deaths from opioids have quadrupled since 1999, and more than 7,000 people died from an opioid overdose from 2018 to 2019 alone. This surge in overdoses is being driven in large part by the use of illicitly manufactured fentanyl, a powerful and dangerous synthetic opioid. To combat this epidemic, it is important to understand what fentanyl and opioids are, how they work, and why they are so addictive. What are opioids and fentanyl? Opioids are a class of drugs that include the illegal drug heroin, as well as prescription pain relievers such as oxycodone, hydrocodone, codeine, morphine, and many others. Fentanyl is a powerful synthetic opioid. It is similar to morphine but can be up to 100 times more potent. Fentanyl is often used to cut or dilute other drugs, which can increase the risk of overdose. According to studies, fentanyl is 50 times more potent than heroin. This means that even a small amount of fentanyl can be deadly. Fentanyl is so dangerous because it is often mixed with other drugs without the user's knowledge, which makes it difficult to know how much fentanyl is actually being consumed. What makes fentanyl and opioids so addictive? Fentanyl and other opioids work by binding to certain receptors in the brain and spinal cord that are responsible for pain and pleasure. When these drugs bind to these receptors, they produce a feeling of euphoria and well-being, which is why they are often abused. Overdose can occur when a person takes too much of an opioid or fentanyl, leading to slowed breathing and/or loss of consciousness. Fentanyl is especially dangerous because it is so potent, and even a small amount can cause an overdose. Here are some symptoms when a person overdoses on fentanyl: slow breathing, low blood pressure, small, pinpoint pupils, bluish fingernails and lips, lethargy, extreme fatigue, excessive sleepiness, confusion, unconsciousness. How does fentanyl compound the opioid epidemic? The use of illicitly manufactured fentanyl has played a major role in the opioid epidemic. Fentanyl is often used to cut or dilute other drugs, which can increase the risk of overdose. And there is an alarming increase in fentanyl-related overdose and death over the years. This is an extremely dangerous trend that needs to be addressed. Combating the opioid and fentanyl epidemic. The best way to combat the opioid and fentanyl epidemic is through prevention. Education is key here because knowing about the effects of using illicit drugs can be crucial to preventing their use in the first place. It is also important for people to understand how easily addiction can occur. There are also a number of treatment options available for those who are struggling with an addiction to opioids or fentanyl. Treatment can help people to recover and lead healthy, productive lives. Get the addiction treatment you need at the Valley. If you or someone you know is struggling with an addiction to opioids or fentanyl, the Valley offers a safe place to start your journey to recovery. We are a full inpatient residential substance abuse treatment center. Our treatment programs are grounded in evidence-based practices and include comprehensive diagnosis, individualized treatment plans, opioid detoxification, substance use and addiction education, therapy, and more. As the go-to addiction treatment center in Rockville, MD, the Valley provides exceptional care in a restorative environment to help patients overcome their addiction and get their lives back on track.